Good afternoon, everyone. Thank you for joining me today. My name is Dr. Chee Seng, and I will be talking to you all about the cancer treatment available in the lung cancer space. So this is a outline of my presentation today. I'm going to run through quickly about the local Singapore statistics in terms of lung cancer, some of the risk factor that has been highlighted by Dr. Chan earlier. I will run through briefly, and I will focus a little bit more on the potential newer treatment options available for lung cancer. For the past couple of years, the top 10 causes of death in Singapore are mainly made up in the slides shown, and cancer always has been remaining the top cause of death in Singapore, attributing to about 28% of all death related in Singapore. In terms of the male, as pointed out by Dr. Chan earlier, in terms of the incidence, lung cancer contribute to about 13%, which is number 3, but they are unfortunately quite deadly, causing the number 1 death among all the male cancers. In terms of female, the incidence is about 7.7% incidence, but in terms of mortality, it's about 15.5%. This is the main issue why lung cancer is a problem in Singapore, mainly because about 70 to 80% of lung cancers, both male and female, unfortunately presented at the advanced stage in the stage 3 and stage 4, where the treatment options are a little bit more difficult and they requires a little bit more comprehensive treatments. Some of the risk factors, as Dr. Chan has highlighted earlier, tobacco would be the most common cause of a risk factor, accounting for about 80% of all the lung cancer cases in Singapore, and is also the most preventable cause of cancer. On the average, adult smoker loses an average of 13 years of life due to this addiction. Smoking not only causes lung cancer, it can cause other forms of cancer, for example, head and neck, stomach, and also kidney and pancreas. And it also damages other body parts, for example, in the heart and the lung, causing a stroke, causing a heart diseases, causing a chronic lung diseases, and so on and so forth. Dr. Chan highlighted the risk of a secondhand smoking could potentially be worse, and there is a very strong link to linking secondhand smoking exposure to lung cancer. And obviously, it's related to the total duration and the intensity of the exposure. It's been estimated that about 27 increased risk of lung cancer if you're married to a smoker spouse, and your parents who are smokers when you're younger, there's a total increased risk of about 10 to 15% in your lifetime. A lot of patients ask me, is there a genetic risk to lung cancer? So generally, lung cancer is not inheritable, unlike certain tumor for example, breast cancer and colon cancer, where 5 to 10% of these cancer previously, as stated, can be inherited. But for lung cancer, it's mostly related to external factor like smoking. However, with the advancement of the genetic testing, there are certain tumor genetic testing that has been identified. For example, EGFR mutation, which can account to about 50% of lung cancer, especially in the female Asian. It can affect male as well. There are other less common mutations, for example, ALK translocation, accounting to about 4 to 8%. I want to highlight that these are genetic related to the tumor, and this is not inheritable from a parents to you or you to your children. Next, we're going to highlight a little bit about the signs and symptoms for lung cancer. Unfortunately, lung cancer symptoms are very non-specific. I think the key word here that we need to look out for is the word prolonged. When you prolong cough, when you prolong breathlessness, when you have persistent lethargy or loss of appetite, or unexplained pain and ache that doesn't go away, it is probably a good time to see a local GP and also to get further investigation to make sure that we do not miss other more serious condition. Once your doctor suspect there may be a possibility of a lung cancer, for example, Dr. Chan could perform bronchoscopy, where basically this is a camera scope through the mouth directly into the lung, and took a little bit of small sample from the lung for further analysis. And depending on the location of the suspected lung mass, there may be an option of doing a needle biopsy direct through the chest wall. Both are very safe and very effective to identify whether or not the lung mass is cancer or non-cancer. For about 85% of lung cancers are made up of non-small cell, and 15% are related to small cell. Majority are these related to adenocarcinoma, which account to about half of all the lung cancers that I routinely see in my practice. Why this matter? Because lung cancer treatment in 2022 is highly personalized. Once we have confirmed that patient have a cancer, this is based on the latest American guideline, where we need to do a further tumor genetic testing. These are some of the basic testing that we routinely do at the present moment to check for the suitability of a newer treatment option. Chemotherapy is no longer the standard of care for lung cancer. There are two newer types of generation of treatment. Number one, oral targeted therapy. If a person has been found to be positive to any of the genetic mutation as listed here, or there are a lot of buzzwords using an immunotherapy for lung cancer, and that has been the standard of care in selected patients as well. The key here is to identify a patient who would benefit the most from this newer targeted or even immunotherapy treatment. Thus, the word highly personalized. So targeted therapy, in the medical field, we call it tyrosine kinase inhibitor, TKI for short. Basically, it's a tablet oral medication for patients who have a tumor genetic mutation. I just want to highlight that this is a normal chest X-ray for a person, and a normal lung should be blackish, and the middle here is the heart. This brings me to the next case, a scenario. Mr. Y is a 64-year-old gentleman presented to a respiratory colleague for breathlessness for about 3 to 4 months. He has done a scan of a chest X-ray. You can see that there's a lot of white, fluffy appearance on this particular chest X-ray, and a biopsy was done, and it was confirmed to be adenocarcinoma. The genetic testing was done on the tumor sample, and we found the most common mutation, EGFR, for this particular patient. This is a PET scan looking at the various light up greenish yellowish tumor samples that was biopsied earlier, and these are all the lung tissue has been replaced by the cancer cell. That is why he was so breathless. In fact, when I first saw him, he requires on a regular oxygen prong to help him breathe easier. So given that he was positive for the EGFR mutation, which is the commonest form, about 50%, I started him on a tablet medication. And this particular gentleman responded quite quickly. Within a week of starting the tablet medication, he no longer requires the oxygen supplementation. And I did a chest X-ray 10 days post starting the medication. You can see that the fluffy white parts are less common, are less visible, and there are more black spots, which are the normal lung tissue, gaining back some of the spaces. EGFR is common, but example, Mr. Z is an ex-smoker, quit about 8 years ago. He first presented a back pain that was continuously getting worse, and eventually to the point of requiring a wheelchair. A scan was done and revealed a left lung tumor with an extensive spread to the bone, and that is why causing a lot of pain, and he can't walk very well. We needed to wait a little bit of time, about a week before the genetic tumor testing was out, and voila, this particular mutation, which is uncommon, was found. And fortunately, it was available in Singapore. And once I started this patient on the tablet medication, walk on his own and back to his baseline ability. And this is a 2-month scan post starting the tablet medication. All the white, purplish spots are the cancer spots. You can see that they have significantly shrunken, and there are still some residual, and the patient continues to benefit from the tablet medication. So let's move on to the next part about the immunotherapy. In the normal immune system, assuming intact, they are, as we get older, as our cells regenerate, when our cell cannot replicate properly in a genetic level, there may be a chance of developing a cancer cell, for example, EGFR. Most of the time, our immune system, the T cell, are very robust, very strong. They can detect all these individual cancer cells and eliminate it before it becomes worse. But cancer cell is very clever in the sense that they camouflage themselves by putting out this particular protein that was not seen earlier. And what it does is to mask the cancer cell from the invasion, from the attack from the tumor's immune system. Okay, once they develop this PD-L1, the higher the level of the PD-L1, the more it masks itself from the immune system, and our immune system cannot detect and destroy them early enough. And that's when the tumors start to grow and start to spread to other body parts. That's when the cancer immunotherapy first invented in 2013, and it was labeled as a breakthrough of the science in cancer immunotherapy. Science is a very prestigious journal who first talked a little bit about cloning. If you remember Dolly the sheep, we talk about the Mars rovers. So this is a highly prestigious, and in 2013, the breakthrough was given to cancer immunotherapy. In fact, in 2018, a Nobel Prize in medicine was given to these two researchers, one from Japan, the other one from US, for discovery using immunotherapy to treat cancer cells. This particular patient of mine is a bus driver. What happened to him was that he had a tumor that has spread to the neck area, lymph nodes, that was quite aggressive, and is causing him to unable to turn. Because of that, he came to see me, and a biopsy confirmed that there is a tumor, adenocarcinoma. For immunotherapy, 30%. 30% means that this is slightly lower than expected, but still you may benefit from immunotherapy. What I started the patient on was on chemotherapy together with immunotherapy. In about 3 weeks after starting the treatment, the tumor shrunk very nicely, rapidly, from a very swollen area on the left neck to almost flat, like a normal tissue. You can see there's still a little bit of inflammation over there. And this is just a CT scan looking internally from a very large tumor to a much smaller tumor. Can we do better? So all the advances earlier has been targeted in mainly in a stage 4 situation. Increasingly, we have seen that we can do better in the earlier stages, for example, stage 3. And also, since last year, during a pandemic, treatment has been approved for as early as stage 1B to stage 3. So immunotherapy has been approved in stage 3 non-small cell lung cancer. I apologize, this slide didn't come up correctly. Basically, durvalumab, which is a medication immunotherapy in the infusion form, has been approved since 2018, has been shown to benefit patients in terms of survival and prevention and relapse of the tumor. During the pandemic in 2020 and also 2021, both the tablet medication targeted therapy and immunotherapy has been shown to be effective for early stage lung cancer. For patients, this typically patients would have gone through surgery for the early stage 1 and stage 2, in some stage 3 as well. And previously, chemotherapy was the only options available. But after a big trials looking at the role of oral tablet and also the immunotherapy, both has been shown to delay the cancer recurrence and improve survival. And thus, during the pandemic, FDA approved these two particular medications. They are also approved in HSA in Singapore for the individual patients who are suitable. For example, in a targeted therapy, patient must be positive for the EGFR mutation, and for patient for immunotherapy must be positive for PD-L1. So in conclusion, lung cancer remains one of the deadliest cancers in Singapore. Tobacco remains the main risk factor. Treatment of advanced lung cancer in 2020 is highly personalized and depending on the individual tumor profile, looking at the genetic molecular mutation. Oral targeted therapy, immunotherapy, has revolutionized lung cancer treatment, both in the metastatic stage 4 situation, in stage 3, locally advanced cancer, and in early stage 1B to stage 3 lung cancers. With that, I end my presentation. Thank you for your attention.